Hello, my name is Andrew Matthews. I'm a member of the Friends of Recovery Orange County Chapter. Won't you join us on Tuesday, May 4th for a Recovery Day of Action, where we will demand that opioid settlement dollars be put into recovery, prevention, treatment, and harm reduction services. Thousands of New Yorkers have died. Families have been devastated because opioid manufacturers lied to consumers. Through herculean efforts of those left behind, opioid manufacturers are now paying for these egregious actions. These funds must not go to fill potholes or build bridges. These funds must go to heal the communities and the families devastated by the addiction crisis. So won't you join us for a rally on Tuesday, May 4th in front of the Government Center at 10 a.m. so that we can demand that opioid settlement dollars be put toward addiction recovery services. Join us Tuesday, May 4th at 10 a.m. in front of the Orange County Government Center. My name is Andrew Matthews. I'm a member of the Orange County Chapter of Friends of Recovery. Thank you.
Friends of Recovery New York is holding a day of action on May 4th in Albany, New York, demanding that the opioid settlement dollars be spent for recovery, prevention, treatment, and harm reduction services and supports. What Friends of Recovery Rockland is doing in Rockland County is holding an in-person rally in front of the Rockland County Courthouse in New City, New York on May 4th from noon to 1 p.m. to localize Friends of Recovery New York's efforts to communicate the importance of using the settlement dollars for the purposes that it was intended for, not to allow that money simply to be absorbed into the general fund for use on unrelated state and local projects. This money was paid for with the lives of lost loved ones and needs to go to building local recovery resources to prevent further harm and loss. Thousands of New Yorkers have died and families have been devastated because of the misinformation that the opioid manufacturers spread to the medical profession and which ultimately resulted in unnecessary overdose deaths. Through tremendous advocacy efforts, opioid manufacturers are now paying for their unethical actions. These funds must go to helping heal the communities which the addiction crisis has ravaged. Please join us on Tuesday, May 4th at noon at the Rockland County Courthouse to let our voices be heard. Thank you.
When I first started doing outreach, I did a survey. And what happened was that the individuals were saying that there were no resources, that no one wanted to help them out with their needs, like housing, addiction, detox, mental health, methadone, Suboxone. And I found that to be odd because there are so many programs out here, right? Especially around in this area. So I decided to intensify my outreach efforts, and that's why I work for Emma L. Bowen Community Service Center at your service. Right here, where we provide wraparound services. We have outpatient medication-assisted treatments. We have outpatient mental health services, all the way from 6-year-olds to very old age. Like I've told you before, my oldest client is an 84-year-old who's on Suboxone, stable, doing excellent. We also have a residential program, Able House, ABLE, which stands for Addicts Benefiting from a Loving Environment. It's a residential program for males and females. At this time, we have 20 beds. We also have a therapeutic program, preschool, for children from 3 to 5 years old. We get these individuals, these kids who need assistance with behavioral issues, we prepare them for public school. We have a pantry where we give out canned goods, pantry on Tuesdays, Wednesdays, and Thursdays, case management services. We have a psychosocial club. Hey, you can't beat it, you can't go wrong. We even have ambulatory detox, telehealth services. You know, we can help anybody anywhere around New York State. So please, come see us, all right? So we can help individuals like this. This guy is yelling and screaming and throws himself on the floor. As you can see, people are still trying to see what's wrong with him. But he responded to the sternal rub, so it's not an opioid overdose. But it looks like K2. There's a lot of K2 smoking in this area. And that's what it is. So every once in a while he gets up, he responds that he's okay, but he's acting a little psychotic. So he's going through a K2-induced psychosis. And that's what that is. And this is why we're out here, to help individuals like this. You know, this is why we connect with Friends of Recovery New York to advocate for the needs of our community. Peace and blessings. Have a great day.
Good afternoon, I'm Victoria Metz, and I'm here on behalf of Friends of Recovery Putnam, Run for Recovery, Drug Crisis in Our Backyard, and Dynamite Youth Community. We're gathered here today as a pre-rally to our rally on May 4th, and we have a message for you.
My name is Susan Salamone. I'm the founder of Drug Crisis in Our Backyard. I lost my son Justin to a heroin overdose on May 29, 2012. We fought for the opiate settlement money that is now being used by Governor Cuomo in the general fund, and we want the legislator to make a lockbox for any future settlement money that comes down so it can be used for support services, prevention, and treatment. This is blood money, and we want it used for those that are still sick and suffering.
I lost my two sons, Edward and William, and I miss them every day, every second of every day. Please help us save lives.
Carol Christensen, a co-founder of Drug Crisis in Our Backyard, and there isn't anything worse than losing a child. And we need the funding to stop this to happen to other families.
This is Justin Salamone. He's the son of my friends Susan and Stephen Salamone. Their lives will never be the same because they lost their son to this terrible disease.
My name is Brianna, and this is Jeffrey, and we are from Friends of Recovery Putnam, and we lost Jeffrey, who was our friend, helped save lives.
I lost Nick, my only child, to an overdose. He never thought that heroin was the same as OxyContin. OxyContin was just a synthetic form of heroin. Please help us to save other people's lives.
This is my friend Carol's son, Anthony. She wasn't able to be here today because she couldn't get out of bed.
This is my son, Alex. He was 19. He was beautiful. He was smart. He was funny. He had his whole life ahead of him. But he's gone. I never thought this could happen to us, but it did.
His beautiful son, Izzy, passed away from drug addiction a few years ago. And the pain it's caused his family should never be continued. And we need the funding for prevention, for education, and for treatment centers so that this does not continue for future generations. Thank you.
I want to thank you for watching our video on behalf of Run for Recovery, Drug Crisis in Our Backyard, Friends of Recovery Putnam, and Dynamic Youth Community. Please fund our lockbox so that we can get resources for people who suffer from substance use disorder so that we don't have any more lives lost. Thank you.
Yeah, I miss you all the time.
Exactly. I took a walk this morning and it like, yeah, my sister does. I live in Ross's Point, but my sister lives in Orangeville, so I go there. I'm sorry. They're not even.
Testing. Do I need to lean in? Or?
Yes. Right. Lean in.
Lean in.
Lean in, Mama.
I'm going to be looking at my notes a little bit.
You don't need to lean in. You're good. You're fine.
All right, good. I was about to say, if my kids can hear me. Are we ready? We need Ruth here to say, what's it all about? Recovery! Ruth is my recovery warrior. All right, so we're ready? All right. Good morning. Good morning. I am Dr. Angelia Smith-Wilson. I'm the Executive Director of Friends of Recovery New York. New York's only statewide recovery community organization. And on behalf of our board of directors and our staff, I would like to welcome you today to this time, this moment in time, this day of action, this day to call upon your action. It is time. It's time to get New York tough, right? It's time to acknowledge the devastation and the destruction the opioid epidemic has done and continues to do to mothers, fathers, sons, daughters, and marginalized communities, especially communities of color. It is time to acknowledge that the opioid litigation funds are simply for those who have been inflicted and impacted. It is time to recognize that not to use these funds to rebuild lives and to allow for access to treatment and the possibility of recovery is continuing to feed the epidemic. The epidemic has stolen from thousands the ability to recover. Overdose robs communities of the possibility of transformation and the contribution that every member of a community brings. So again, it is time. Let's be New York tough and lock these funds up. These opioid litigation funds, let's lock these funds up solely for the purpose of prevention, treatment, recovery, and harm reduction. Thank you. And now, to bring up one of our most constant champions in the recovery fight, Senator Pete Harkum.
Thank you, Angelia. Good morning, everybody. Good morning. And to my friends in recovery, it is always so good to be with you. Your story is my story, as we have discussed. And when we talk about overdose, your loss is my loss. We have lost so many beautiful, beautiful souls. We are in a national crisis. We are in a crisis right here in New York State, and overdose is preventable if we have the resources to address the crisis. And where are those resources coming from? We're going to be getting resources thanks to Tish James and her leadership. Our Attorney General is leading the national fight to hold these pharmaceutical companies accountable. as the good doctor just mentioned, must be put in a lockbox for treatment, prevention, recovery, and harm reduction. That's how we're going to attack this crisis. We have come so far. We have done so many things, and yet there's more to do. We've doubled treatment times. We've made MAT much more accessible, both in a correctional setting to people with insurance. We still have more work to do on the Medicaid side. Transportation initiatives we've passed. We have done so many things, and yet there is so much more to do. As long as one person is dying from overdose, we need to commit every dollar. You cannot put a price tag on a human life. So we are here today to recommit that this session we will pass legislation working with the Attorney General to put these funds in a lockbox, not to pave roads, not for walkways to wherever, but for treatment, prevention, recovery, and harm reduction in order to save lives. And that is our pledge today. Thank you, and God bless you.
Thank you, Senator. And now for Luis LaBoyce.
Good morning, everyone. First and foremost, let's have a moment of silence for those loved ones suffering through this pandemic and those that passed away as a result of an overdose. Thank you. Our community continues to suffer the trauma triggered by the COVID-19 pandemic that has evolved into an economic crisis, racial injustice, public unrest, suicide, health issues, gambling, homelessness, gun violence, syringe waste, public drug use, and an unprecedented surge of overdose deaths from prescription drugs, heroin, and fentanyl. I want to acknowledge the countless families and loved ones here today that have been living with the anguish and pain caused by the horrors of this opioid pandemic. May our future be filled with hope, unity, and love. My name is Luis Angel Laboy Lozada de los Sures. I'm from the Bronx, a person in recovery for 23 years without using drugs. Thank you. My family and my whole life has been ravaged by opioid addiction. Unlike my father, who was murdered over drugs, I survived a fentanyl overdose in 1991. And with the intervention by the Department of Corrections and Phoenix House during my last incarceration, I have been able to recover since 1998. Today, I'm the Director of Addiction Services and Community Engagement for Emma L. Bowen Community Service Center located in Harlem, providing substance use disorders and mental health services for individuals starting from 3 years old to very old age. For help, call me. Recovery is possible. I'm the chairperson for the Bronx Council on Alcohol and Substance Use Disorders, as well as a proud member of the New York State Alumni Association. I'm a humble certified recovery peer advocate, compassionately representing the recovery community everywhere I go. We are so grateful to see financial reparations being collected by the Office of the New York State Attorney General's Office from companies that have profited from this horrifying opioid pandemic that has passed 90,000 overdose deaths in the U.S. for the year ending September 2020, according to the CDC. We want recovery, and we want it now. We, the people of the recovery community, want these settlement funds to be placed in a lockbox, and that the New York State Office of Addiction Services and Supports, OASAS, is placed as the agency that drives conversations with our input on how these funds are to be spent in the creation of new projects, workforce development, focused on prevention, treatment, recovery, and harm reduction. Settlement funds should not be used to supplant existing funding. As peers in recovery, we need to provide the community with the resources needed to strengthen our combat on addiction. To all our government representatives, please hear our cry. What do we want? Recovery. When do we want it? Now. Nothing about us without us. Thank you.
Thank you, Luis. I'm Allison Weingarten. I'm the Director of Policy for Friends of Recovery New York, and I'm going to keep this program going. It is strong. The next person I'm going to call up is a wonderful ally to the recovery movement, Assemblyman Billy Jones.
Thank you very much, Allison. Thank you for putting this on. I'm going to keep it very brief because we have many speakers here and many advocates. We've all heard the stories from families and from people, individuals that have gone through this devastating crisis that we're having. It affects people. It affects real individuals. It affects families. It affects our friends, our neighbors. It affects us all. And when we talk about power, we as elected officials have the power to prevent this in the future. We have the power to prevent families and individuals to go through this in the future. There's power in recovery. We have the power to do this. We need to make sure, and it is an incumbent upon us to make sure that these funds that come in go directly to the professionals, directly to treatment and recovery, to make sure those individuals get the resources that they deserve and that they need in treatment and recovery. We have the power to do that. It is incumbent upon us to make sure that happens. We will do that. We will make sure the fight continues. Let's keep it going. Thank you so much for all your advocacy, for everyone here. Thank you. We will continue to do this. The fight goes on.
Thank you so much, Assemblyman. And another great ally, Assemblyman John McDonald.
Thank you, Allison. And of course, good morning to our friends from recovery, but also to my colleagues at all levels of government and elected office as well. We all know the scourge of the opioid and heroin crisis. We've lived, unfortunately, through this. We've seen many close friends and family members, not only loss of life, but also the pain and suffering that's left behind. At the highest levels, the opioid crisis has been litigated. Drug manufacturers, drug distributors are settling with our Attorney General. Resources are going to be coming to our state. They've already started to trickle in. More are going to be coming. But we need to make sure that those funds are used appropriately. We need to make sure they're dedicated, because we know that education works, we know that treatment works, and we know darn well that recovery works. We need to make sure that the resources working in partnership with OASIS is able to support all the initiatives that we know are successful. And if we stick together, work collaboratively together, I know that we'll be able to pull it across the finish line. Thank you very much.
And now an amazing recovery advocate from Recovery Advocacy in Saratoga, Maureen Provost.
Good morning. Thank you. My name is Maureen Provost, and my husband Ken and I are family members impacted by addiction. We've been involved with Recovery Advocacy in Saratoga since 2015, and the Healing Springs Recovery Community and Outreach Center since 2016. This coming Sunday is Mother's Day. I will be spending the day at St. Augustine Cemetery at the grave of my son, Daniel Provost. My son, Dan, will not be bringing me flowers nor giving me some silly mug for Mother's Day again this year. Dan died in 2014 as the result of a heroin overdose. While he was willing to seek help, there were insufficient services and facilities in place. There was insufficient awareness and acceptance of substance use disorder as an illness. There simply was not enough opportunity for Dan to enter recovery. The state of New York cannot allow that to happen to one more individual. The opioid litigation settlement dollars are a windfall that need to be properly allocated to recovery service organizations to benefit New York State residents who are struggling with addiction and seeking recovery. Our state needs these services, our citizens need these services, and our children need these services. Our asks today are threefold. Please place the opioid litigation settlement dollars in a lockbox and dedicate those funds to substance use recovery programs and services. Please lean into OASAS for direction on the use of the opioid litigation settlement dollars, as they have the experience and the knowledge to most beneficially administer the proceeds, thereby benefiting those most impacted by substance use disorder. Please do not allow the opioid litigation settlement dollars to supplant existing service funding or to be utilized to cover other gaps in the general state budget. There is a crisis at hand, and the state of New York has a moral imperative to direct these settlement dollars to recovery services in an effort to give them better access and hope to those who struggle with addiction and to those that love them. Thank you for your time this morning.
Thank you so much, Maureen. And now another wonderful recovery ally, Assemblywoman Carrie Warner.
Good morning, everyone. I want to begin by thanking Ken and Maureen Provost, who are from Saratoga Springs, for their tremendous advocacy, and to thank each and every one of the advocates who are here today who have been impacted by the disease of addiction. That you are standing and raising your voices for all of those who are still struggling, all of those in recovery, is inspirational to all of us. There's a young woman who couldn't be with us today, who has been a champion and who has really helped to educate me as to the importance of the topic we are discussing today. Ashley Livingston from Hudson Falls, who could not be here today, what she would say if she were here is, these are not free dollars. Each one of the dollars that our great Attorney General is recovering from the drug companies who have pushed these drugs has been purchased with the life of an individual who has died because of these addictions. Each one of these dollars has been purchased by the grief of family members who today are looking at Mother's Day and not able to be with their family member. That's what we have in this state, is too much grief, too much loss because of these drug companies. But as my colleagues have said, we have the power to start to fix this. As these monies come into the state, these monies need to be directed to meet the needs of people who are struggling. They need to go to prevention, to treatment, to recovery, and to harm reduction. So it is very critical that we work to make that happen. I'm very proud to have introduced a bill in the Assembly, A 6395, that does just this.
And I will be working with the help of my colleagues to make sure that this happens this year, so that as those monies come to New York, they go to the people who need them. They are directed by OASAS, the organization that is most best suited to make the dollars go where they need to go, and that they are supplemental to what we are already providing for these services. Thank you so much for being here. Thank you to the advocates. Thank you to my colleagues. Let's get to work.
Thank you so much, Assemblywoman. And now another amazing recovery advocate, Nydia Hill.
Buenos días. Buenos días. Mi nombre es Nydia Hill y soy una persona que está sobria por 18 años. Y si no fuera por la recuperación, por el tratamiento que yo recibí, yo no estuviera aquí hoy. I always start, my name is Nydia Hill, and I'm a peer advocate with New Choices Recovery Center Cody Project. I'm a person in long-term recovery. I've been sober for 18 years. Through the process of the drug court systems of Montgomery County, I got here. And since then, I have been on my feet doing this work to help others come in. These monies that are going to be received belong, like everyone else says, to the people that are still out there suffering and the people that we lost. We do not have the right to take that money and do anything else with it. It is not our money, it's their money. For me, I fight in Montgomery County to make sure that Hispanics like me that cannot speak the language get services. It's almost impossible. I have to call Lewis in the Bronx to help me find treatment for my people in upstate New York. Why? Grateful for all the other help that we get, but we need to do more. We need more help. Recovery works. I am living proof. My children are living proof. They're all college grads because I got clean. My family, right? My family is so grateful that whenever I come up with something and I need money for something, they give it to me if it's treatment related. Sometimes for patients too. But what I'm saying is, when I recover, my family and my community recovers. Thank you.
Great job, Nydia. Thank you so much. Next, I am calling up Albany County Executive Dan Mccoy.
It's an honor to be here, and to all the speakers that went ahead of me and the senators in the Assembly, thank you for your support. 5 years ago, when I took on the opiate fight on a federal level, on a national level, Albany County today is still the smallest county in the room of any other state in this great nation of ours. And I realized then a lot of people didn't want to take that fight on. And I remember being in Cleveland, Ohio, and we're in a courtroom, and all the attorneys are excited. They're like, this is like the Super Bowl. We're going to change things. We hired Motley and Rice. Joe Rice is at the table. And the first thing they said, the Slacker family, was that our attorney general then, not the new one, thank goodness, not the new one, settled for $35,000 with the opiate. $35,000. And I knew the fight I was taking on. But having friends, and especially family members that are fighting addiction, and my brother's been fighting for 22 years, and every day still a struggle. My other brother is recovering. This July will be 13 years. Losing friends and family to the opiate, something had to be done. But I realized when we were changing stuff, I said, I had the crystal ball. I remember talking to the federal judge. I go, Yeah, I know once the money gets to the state, it's just going to go away. And my argument the whole time in that courtroom was one thing, that this money gets utilized for programs that help people and trying to educate people, not just in the state of New York, but across this nation, that rehab can't be 10 days. We need to go back to 30-day rehab, 60-day rehab. And if you relapse, the insurance companies don't let you go back. Anyone who fights addiction will tell you, you got to find the lowest point in your life sometimes, and it might be for you and I. But even then, it's not low enough for that person to change their life around. They got to want to change. And you have to understand to be there with them through the mental struggles they have, through the addiction struggles they have. Build them up, get them better, then kick them in the ass. Once they're healthy. But I was not surprised when I heard this money was just going to go back into offset programs. We need to think outside the box. That bill is awesome. Thank you. You have to look outside. Get the universities involved. Analyze all the programs. Are they working? Are the programs we've been doing for 50 years still effective, or we need to change it? Give opportunities. I was watching Shark Tank, and it was interesting. Doc Spartan product, veteran-owned, was from Portsmouth, Ohio, which was also called the pill mill of the United States and was the hardest hit with the opiate addiction. They went back, started a business, and what got me to really look at what happened was he gave opportunities for everyone in recovery to have a job, to come get recovery and have a job, because that's what matters. We need to get back on our feet, but if there's no opportunity to change our lives to move forward, we fall back. So keep this in mind as we look at the money coming in. Look at job opportunities and creation for people that are going through rehab. Look at changing their life so they have a better outcome. And it will work then. It only work, but you need the treatment. You shouldn't. I do love Brooklyn. No, you got to do it. Yankees. I'm a Mets. The have to go there is ludicrous. And I want to say to the Senate and Assembly members that are here, thank you to make sure that this money goes to where it needs to go. And that's at the end of the day. Listen to the people in the programs. Listen to us politicians. Listen to the people to the left and right of you. Let them tell us how that money could better be utilized for services and to change the quality of life. Not let us dictate to them or a state agency dictate to them what they think is best for the community that they don't live in. They're not in the trenches. They don't know what people struggle every day, and thank God that they don't. But to make a difference, you just got to listen to the people. So thank you, thank you, thank you.
Nothing about us without us. Nothing about us without us. Nothing about us without us. All right. Thank you so much. Calling up another amazing family member, Tim Murdoch.
Hi, my name is Tim Murdoch. I am the president of the No Opiates Committee, but today I'm here as Tim Murdoch, private citizen. Tim Murdoch, the husband, community member, father of someone who lost his struggle with opioid addiction. We are part of a very special and elite club, a club that nobody wants to be part of, a club that the provosts, unfortunately, are part of. We started this battle just almost 6 years ago, and it was very apparent at that time what needed to be done. And obviously it was with Big Pharma was number one on the hit list. It was also with government not taking the right corrective actions. Well, we're kind of there. Now we're holding Big Pharmacy accountable, and it's in this lawsuit. But I got to drill down a little bit here. I do agree that the money needs not go to the general fund, absolutely. And as Mr. Mccoy had said, talk to the communities. That is so important. The counties in New York State need to have a say in how this is done. Every county is different, just like everyone in recovery is different. There is no cookie cutter solution for everyone suffering from the disease of substance use. So please, when we do sit down at a table, I would like to see us form, you want to call it a coalition, have the money not in the general fund, in the toolbox, to Oasis. Oasis sits down with local coalitions, sit down with local counties, sit down with the local health department directors. Let's come up with a plan, and we dictate on how this is going to roll out. Like Mr. Mccoy said, we don't need to be told. We know where the shortfalls are. Let us make the decisions on where we can best use this money. Thank you.
Great job, Tim. Next, I'm going to call up another recovery ally, Assemblyman Chris Hay.
Well, good morning, everyone. First of all, I'm Assemblyman Chris Haig, and I deeply approve this message. First of all, I want to let Assemblywoman Carrie Warner know that I will be signing on to your bill as a co-sponsor today. Yay! And I'm no stranger to the recovery movement. When I was a town supervisor in my hometown, I joined SCAZA in Schoharie County because I didn't understand enough about the addiction. And I had lost one cousin, and I'm proud to say that I have another cousin who's been sober for 12 years due to recovery services. So I'm here today to stand with those recovering from addiction and those who support them, and to ensure any money received by the state from litigation against drug companies goes where it belongs, towards helping people living with addiction in their recovery. While COVID may dominate our news cycle, the truth is the addiction has not gone away or been diminished. In fact, it is a greater problem than ever. For many people, the isolation that came with the pandemic only made their battle with addiction more difficult as they became distanced from their support networks. And they need our help more than ever to overcome the challenges that they face. The money from these lawsuits need to go to the people hurt by these drug companies, plain and simple. This money needs to be put in a lockbox with strict controls on how it can be used, and those who have lived through addiction, along with the Office of Addiction Services and support, should be ones driving the conversation about how to do so in a way that will best serve the people that need it most. To see this money that has been fought for so hard go to waste would be a tragedy and an insult to those who battle with addiction every day. So I stand here today with Friends of Recovery to see that every dime our state gets from opioid manufacturers go towards helping the people affected by still persistent crisis of addiction. I want to thank all of you for the work you do in helping those in need, especially in these last few months. Your support has saved countless lives. I will continue to fight by your side. The battle against addiction will not be won easily or anytime soon, but I will do everything I can to help you give people hope and support as they live with addiction. God bless you all, and thank you.
Thank you so much, Assemblyman. And now another recovery ally, Assemblyman Jake Ashby.
I want to thank everyone for coming out today. It's always a little difficult to follow my friend Chris Haig. Tends to get the crowd riled up. But, I think everybody here is riled up, for the right reasons. And County Executive Mccoy had a good point. And, from a legislative perspective, I don't know how anyone could not be in support of Assemblywoman Warner's bill. I think everybody here plans on supporting that. But from the perspective of a recovering alcoholic, I can tell you that money should be going to people like Luis. It should be going to people like Lydia. Yes! Because when you find yourself at that moment looking for help, you don't want to hear that it's in a slush fund. You don't want to hear that it's not accessible. You want to see them. You want to hear their stories. You want to see their examples. You want to be able to look forward the life that you can lead with your family going forward. You have to be proactive, and this is a proactive measure. We can't be on the defensive with this. We need to be offensive. And legislation like Assemblywoman Warner's bill and what we're seeking to do today is an offensive measure to take to this fight. Thank you, everyone, for coming out today and continuing to fight for this.
Thank you, Assemblyman, and thank you for sharing your story with us. Next, I would like to bring up an amazing advocate for this field, John Coppola.
Morning. I want to first start by thanking Ken and Maureen and Tim for being with us this morning and for sharing their grief and loss with us, and also their courage and working with us to change the system. In Avi, Israel, Linda Ventura, so many of us have met so many wonderful, beautiful parents who've lost children or lost spouses, parents, and it's not acceptable. And as Maureen was speaking, and she mentioned when her son passed, not wanting others to follow and have the same kind of an experience. The reality is that when her son passed, if we look at the progress that we've made from that day to this day, it's not in the right direction. Beds have closed. Staff have left the field for better pay to support their families. We have beds and programs that are empty, but if somebody wanted that bed, they wanted treatment in that program, they wouldn't get it because there's no staff person. That bed is not able to be safely used by somebody because the staff is not there to guarantee their health and their safety. The system that we're trying to support and strengthen is actually becoming more and more precarious. So here we are with funding coming from the courts. Dan Mccoy mentioned 5 years of work at the national level. A number of years ago, he had a team of attorneys who were representing all of us in that national fight. And it was clear to me, that his passion for this issue was also mirrored in all of the attorneys. And I had a lot of confidence that day that we were going to succeed. We were going to prevail in the courts. And so here we are today, having to have a rally like this to say, after all of that work, and after the good work of the Attorney General and the judges and the court saying, of course, there's something that needs to be remedied here, billions of dollars will now be available, and the court is saying for prevention, for treatment, for harm reduction, and for recovery work. And we have a question? Yes. We have a question about whether those funds are going to be used to supplant existing funds, which are already inadequate. We have a question about this. We have to rally for this. We need our legislators to do special bills to make sure that the money doesn't wind up someplace else. And it is absolutely predictable. If we did not have the kind of leadership from Senator Harkum, from the Assemblywoman, from all of the Assembly people and senators who are behind us, if we did not have their support, it would not end well. So I just want to just say that this is not a case of a lot of money coming into the state, and then we've got plenty already. We've got plenty of resources, and this is some kind of a money grab. This is about survival of treatment, survival of prevention, survival of recovery services. We don't have access, and a gentleman who spoke about his own loss and is now advocating for the counties to be involved. There are so many counties that don't have access to a recovery center, don't have access to the resources they need. So these funds should absolutely be designated for the purpose it's intended. And we still want to say thank you to all the legislators that are working to make that happen. I want to also assure you that the passion you feel here, we will absolutely mobilize every legislator we can to support efforts to make sure that these funds for years to come will be utilized for the correct purpose. Thank you.
Thank you.
Next up, we have someone who knows her way around prevention. She's about to retire. She's put so many years into this work, but she doesn't look like she has. Nancy Jones.
Good morning. Good morning. So, thank you. I'm Nancy Jones, and currently I'm working at New Choices Recovery Services in Schenectady County. Yay, Schenectady. I have been passionate and working in this field since 1989, and I just want to let you know, Schenectady does not have a recovery center. So, in case anybody wants to mention that. Anyway, I'm not going to mince words today. We got to act. We have to act now. The opioid settlement dollars need to be allocated to help with the damage that has been, caused by them, not diffused into the general fund. Opioids took lives and still take lives. Just so you know, it's not done. It's not over. We had in 2020 during a pandemic, we had over 1,300 people enter treatment for opioids in Schenectady County. That's in Schenectady County. That's a little county, in case anybody didn't know. Opioids have stolen the dreams and continue to steal the dreams of so many of our families, so many of our children. Their careers, their dreams, their hopes have gone. So, number one, make sure the funding goes to the Office of Addictions and Support Services, OASIS, and have input from the people it impacts, from the professionals, the providers, from the people who have suffered from this opioid crisis. So that I ask one thing, if we can get the money there so it will be appropriately spent and used to really make a change. I am an advocate for prevention. I want everyone not to have to suffer from a substance use disorder. So that is where my passion is, and I work with children every day to help them get the skills and have the education and the knowledge to make better decisions for themselves and to fulfill their dreams. So I can tell you stories and stories over the decades of so many children that have gone down the wrong path. And thankfully today I do see a few of them that have come back. There's my little friend there. And it's so nice to see. But again, prevention needs to be a priority. I know we're here for Friends of Recovery, and I am an advocate for treatment, recovery, harm reduction, and prevention. But we will never have enough ambulances at the bottom of the hill to, as the story goes, to save everyone. So prevention needs to be a priority here in New York State, so that families and youth can have the skills and the strength to live healthier lives. New York needs to expand the funding for prevention, treatment, and recovery services, and not supplant the money. We all know we need more. We all know it's a tough fiscal time, but wellness has to be our top priority. If you want New York to build a healthier life and have economic sustainability, then we need wellness and we need health. So my words are, this has to be acted on, and it has to be acted on now. Thank you.
Now I'm calling up another amazing advocate, Courtney Hunter. And if you could come, if anyone from your ambassadors could come with you, that would be great.
Hi everyone, my name is Courtney Hunter and I'm with the national nonprofit Shatterproof, and we are dedicated to reversing the addiction crisis. We have wonderful, amazing ambassadors, Dee Dee, who lost her son Chris in New York, Sammy and Chris here with us today to advocate. A couple of years ago, I was in DC advocating for passage of the Comprehensive Addiction and Recovery Act. And I was with fellow New Yorkers, Bill Williams and Margot Head. And I said to them, I can't believe you tell your story every day about, your son that you lost after being denied inpatient detox at Beth Israel Hospital. And they said, how can we not do this? We're just at the starting line and we're wearing comfortable shoes.
Yay!
And I want to share that message today because the reason that addiction funding is where it is because it's always on the chopping block. And that is changing. We are here. We are living proof of that. We are going to make sure that these dollars go to the services and that no more children have to die from this horrible disease. And I'd like to turn it over to Dee Dee if you'd like to say anything.
Yes, thank you. Hi, my name is Dee Dee. I raised my son Chris in Irvington, New York, in this beautiful little town on the Hudson River. I was a single mom. I worked hard. My son was a happy kid, very active. Unfortunately, he had several injuries from snowboarding and skateboarding and all the things that kids do, and he ended up having several knee operations, which were both followed by opioid painkillers. And then oddly enough, the same year, he had an acute appendectomy and ended up in Westchester Medical Center, and followed by more painkillers. And by his senior year, he kept acting more and more strangely. All his friends were trying to help him. He ended up, I found out from the guidance counselor that he was doing heroin, that one of his friends told a teacher because they were so worried about him. And I had no idea about painkillers. The doctor prescribed it. I thought it was perfectly fine. So it was followed by 5 years of different rehabs. I kept asking doctors, emergency room hospitals in the greater New York area, you'd think you'd have the best care anywhere. And no one could help, no one could direct us. I spent most of my retirement on his rehabs. The insurance didn't cover it. And he died of a drug overdose at the age of 21. So I support anything that's being done here today to help everyone in the future not have to go through that and not have to lose their beautiful child. Thank you.
Thank you. Thank you.
Great job, Courtney. Did I miss any elected officials? Okay. Well, I just want to say this was just a beautiful showing of the recovery movement. We are people with lived experience, family members, friends, allies, and this is just, we came together, we're outside, we're being safe during COVID, but this is so important to us. So I just want to do a little rally call because I'm so proud of each and every one of you for being here today. So let's see, where's Schenectady County at? All right, Schenectady, where's the Bronx? Yes. Where is the North Country? Yes. Where is Schoharie County? Yes, thank you for being here. Where is Friends of Recovery Delaware and Otsego? Yes. Westchester is in the house. We have Montgomery County. Rensselaer. Yes. We have, anyone coming in from Albany? We have Saratoga. Did I miss anybody? All right. So, and we have rallies going on all over the state today. We've got Long Island, if you're out there. We've got Staten Island. We've got Rockland County, Orange County, Putnam County, and Buffalo and Rochester. And something's going on in Binghamton. So we're everywhere. And we are so proud to be here, and we have to be grateful. There are so many things to fight for, but we have to be grateful that we have each other. So I thank all of you for coming out, and we're going to do this. And we're not stopping today. We're not stopping until it's done, right? So what do we want? Recovery. When do we want it? All right. Thank you, everybody. Great job. Thank you so much. Thanks for being here the whole time, too. It means a lot.